I'm Anna Followell. Today I'm going to be performing a head-to-toe assessment for you. This is my patient. He will be remaining in his tank top and shorts in order to protect his privacy. I'm going to go ahead and get started. Hi, my name is Anna. I'm going to be your nurse today. Can you please tell me your name?
My name is John Johnson.
Hi, John. I'm going to ask you a few questions. Is English your native language?
Yes, it is.
Great. Can you please tell me your date of birth?
My date of birth is January 1st, 1991.
So how old are you?
26 years old.
26. Very good. And your, what's today's date?
Today's date is March 18th, 2017.
Correct. And can you also tell me the location, city, and state that you are currently in?
Pensacola, Florida.
Very good. John, I noticed that when you walked in today, you didn't need any assistive devices. Do you normally need assistive devices?
I do not.
Very good. Also, John, are you having any pain today?
I am not.
So I noticed in your health history that you mentioned that you've had frequent headaches as well as some difficulty concentrating at work. But we'll go over and do a complete head-to-toe assessment on you, and you let me know if I cause you any pain or tenderness, okay?
Okay.
All right, so at this time, I want to go ahead and say that my patient is alert and oriented. He was able to respond correctly to questions. His hearing is intact because he wasn't asking me to repeat any of the questions that I asked him. He also is sitting comfortably. He's breathing even and unlabored. He's able to speak English, so I don't need a translator. And as far as his pain level, he doesn't have any pain. So I'm not too worried about causing him more pain as I go through my assessment. But I did ask him to speak up if he had pain. From this point, I would also want to direct my patient to change into a gown if needed. But since we don't have a gown, this is what he's going to be wearing. I'd also want to make sure that he is quite comfortable before I begin my assessment. So I'd ask him to use the bathroom if he needed to use the bathroom. Once I've done that, I would go ahead and get his height and weight. John, can you tell me your height?
My height is 74 inches.
And can you tell me your weight?
170 pounds.
Okay, so if I take his height and I take his weight and I calculate it using a BMI scale, I would determine that his BMI percentage is 21.8, which shows that he has a healthy body weight ratio and percentage. So he is seems to have adequate nutrition, and also by looking at him, I can tell that he has adequate nutrition. Once I've gathered that, I will also want to gather his vital signs. Today, when I gather the vital signs, I don't have with me a thermometer, a blood pressure cuff, or a pulse ox machine, but I will tell you how I would do those things. So I would first take his temperature. I want to look for his temperature. Usually I do it orally, and I would also be counting his respirations during this time. I'm not going to tell him that I'm counting the respirations because I want him to breathe as he normally would. I would monitor that for at least 30 to 60 seconds and make sure that his breathing rate is normal rate and rhythm, which it is. Right now, I'd say he's breathing about 16 respirations per minute, which is normal finding. He doesn't show any signs of respiratory distress or cyanosis, so I'm not too concerned about his difficulty breathing. Also, I would want to get a pulse ox reading, so I'd be checking to make sure that his oxygen saturation is of normal levels, so about 95% or higher would be considered normal for this patient. I'd also want to check his pulse. So I could check his pulses by checking them radially. His radial pulses. The radial pulses, I would say, they're even on both sides. They're about 2+. They're of a normal rate and rhythm, which is good. I can check pulses in other areas of the body, and I will do that later on in the video. Good. I want to check the pulses in real life for about a minute, but for today and for the sake of the video, we'll not be doing that. Once I've checked the pulses and I found a normal rate and rhythm, it's unable for me to tell whether or not he's in sinus rhythm unless he's hooked to a monitor, but I can tell you that it's normal rate and rhythm. I'd also want to check his blood pressure. So his blood pressure, I can check that bilaterally using a blood pressure cuff. so on both arms. But also, if he told me that he had a history of dizziness or orthostatic hypotension, or also he had a fall risk, then I would want to check his blood pressure as he lied down, as he was sitting up, and as he was standing. I'd also want to make sure that the mean arterial pressure, when I checked his blood pressure, was above 60 to ensure that he had good circulation. Now that I've checked all of his vital signs and everything is normal, I'd want to begin my head-to-toe assessment. My head-to-toe assessment, I like to start with the head and actually move all the way down to the toes, leaving the lower extremities for last. So I'll go ahead and start with the head. Should make sure I have my appropriate PPE on, but my hands are nice and clean before I assess the hair. Do you have any tenderness?
No, I do not.
So no tenderness. There's no lesions, no lacerations to the head, no bumps. The hair is nice and clean. It is brown in color. It is evenly distributed, shiny but not oily and not overly dry. So a head is good. I can also check the hair on the eyebrows, which are even distribution of eyebrow hair, even distribution of eyelashes, and even distribution of facial hair here, just a light facial hair. Once I've checked the hair, I'm also kind of doing this whole time, I'm doing an overall skin assessment of the skin that I can see on the body. The arm hair is in even distribution in all areas. The leg hair appears to be even distribution. It appears to be clean. He is a clean person. He's well groomed. His skin and hair is all very age appropriate for a 26-year-old. Once I've done that, I can also look at his eyes. So in order to assess the eyes, I'm going to be looking for several things. Cranial nerve 2, 3, 4, and 6 are all cranial nerves that assess the eyes. I don't have an otoscope with me today, so we won't be doing any internal eye examinations, but I will look at his eyes from what I can see. So, sir, if you don't mind, I'd like you to look down for me, and now I'd like you to look up for me. So I checked his conjunctiva, which is nice and clear. His sclera is white, which is appropriate. I want to check his peripheral vision. So how I can do that is, sir, I want you to look straight at me, and I'll sit down so this will be easier. I want you to look straight at me, so do not turn your head. I'm going to place my fingers on either side of your earlobes, and I want you to tell me which, about 12 inches away, and I want you to tell me, keep your eyes looking at me, tell me which finger is moving, okay?
Left.
Good.
Right. Right. Left. Right. Left. Left.
Good. So his peripheral vision is intact. So that would be what I was assessing for with the cranial nerve 2. Also, I want to check for his perla. So the way I can check for perla is I'm looking at his pupils. His pupils are equal. They are round. I want to make sure that they are reactive to light. So I'll shine my light right in between his eyes, so on his nose, and look for a constriction, which they did constrict, so that's good. And I also want to check, so they are reactive to light, and I want to check for accommodation. So I want you to stare back behind me, and now I want you to stare at my finger. Good. Stare back behind me, stare at my finger. Back behind me, and at my finger. Good. So his eye movement was symmetrical. He was able, his eyes constricted when they looked at my finger, which was close, and then when he looked back behind me, they were able to go away from the finger and look back behind me at about the same time. So very symmetrical, which is good. Next thing that I want to do with the eyes is I want to check the eyes for the 6 cardinal positions of gaze. So how I'll do that is I would like you to follow my finger. Once again, I want you to keep your head straight, so don't move it side to side, and follow my finger with your eyes. Okay, so he was able to follow my finger with both eyes. I did not see any shaking of the eyes, which was normal, so no nystagmus was noted, which is a good finding. Also with the eyes, I want to make sure that he has good red reflex and good corneal reflex. Red reflex I'm not going to really be able to do today, but for the corneal reflex, how I could do it is take a very thin piece of cotton and slowly, keep your eyes open. Yep, just slowly drag it across his eye, which I did, and he immediately blinked, so his blinking is intact. Moving on from the eyes, and I already talked about the eyelashes being an even distribution, eyebrows being an even distribution. I want to move on from the eyes, and I want to focus on the ears. So looking at the ears, I will assess for both sides. Is there any tenderness noted?
Nope.
Nope. Excellent. And also, I don't see any cerumen, no drainage from the ears. Can look in the ears with my light here. Okay, and I don't see anything inside the ears. If I had an ophthalmoscope, what I could do is look inside for the tympanic membrane, which I would be looking for a pearly gray tympanic membrane, but I'm unable to do that at this time. I can feel in the ears, they are in line with the eyes, which is good. They are symmetrical. Very good. So cranial nerve 8 is the vestibular cranial nerve, which assesses for hearing, so I will be assessing for the whisper test. I'm just going to do it on one ear today, but how this is, sir, I'd like you to take your finger in this ear and kind of wiggle it around, and keep doing that as I stand over on this side, and I'm going to whisper to you either letters or numbers, and I want you to tell me what I'm whispering.
2. 13. W. X.
Very good. So normally I would be testing for both sides, but for the sake of this video and time, I will not be doing that. But he was able to, I was whispering to him, and he was able to distinguish the different letters and numbers, which is good. So I would say his hearing is intact. Moving on from the ears, I will move to the nose. So the nose affects cranial nerve 1, which is the olfactory. So what I like to do before I even test the senses for smell, I want to just look inside his nose. No drainage is noted. There doesn't appear to be any swelling. The septum is not deviated. However, a deviated septum, as long as it's not causing any difficulty breathing, is normal. Yep, and there's no redness, swelling, smooth nasal bridge. Okay, put your head down. And he's able to breathe fine. I'm looking at him, and he's able to breathe fine. So what I'd like you to do is with one finger close the nostril and take a breath for me. Good. So he was able to breathe normally, no difficulty breathing. This time I'd like you to do the same thing, except I want you to smell this and tell me what you smell.
Smells like chocolate.
Good. On the other side, I want to do the same thing. So take a, close the other nostril and take a deep breath. No difficulty breathing. Then the nostrils are painted.
Peppermint.
Peppermint. Very good. Yeah, so his sense of smell is intact. Moving on from the nose, I want to assess the mouth. So just looking at the mouth, he doesn't have any blisters or lesions on the lips. The lips are nice and pink. There is no cracking noted. I once again would have gloves on before I touch the mouth, but I don't have gloves, and I do know this patient volunteered very well, so I'm going to go ahead and touch his mouth without putting on gloves this time. So I'll be looking inside the lips. Good. Nice and pink and moist. Keep your mouth open. Wide. Good, and lift up your tongue. Okay. All right, so back, in the back you can see the uvula is nice and